people just die like it's a joke because someone failed to take their case seriously. Someone just dismissed them, saying, you know, you're imagining things, you're doing all that. I was told many times, you're fainting because you have panic attacks. They were mentioning some, you know, sort of weird methods of treating and cutting me and all that, and mentioning it very casually, like it's nothing. So imagine what could have happened if someone, you know, opens you up to do something that is not the case. Things could have really gone south really fast. First, I would have gone under the knife without really having the real diagnosis. Hi, my name is Deborah, a registered nurse, and I'm here to talk about the nightmare that patients are put through in the hands of doctors and other healthcare workers in our public and private hospitals. So one time I go into this doctor's office to consult for a condition that was really a problem for a long time. So he takes out the imaging, looks at it, and you know, he's quick to jump to a conclusion that I need surgery, like urgently, like now. He writes admitting prescription to the nearest private practice hospital that he works with. And he was very radical about it, saying how he will just cut open here and, you know, explaining all these things. And I later came to learn that that was actually a misdiagnosis, and whatever he was saying was not the case, and whatever surgical approach he was proposing is not even acceptable. And it's a nightmare for most Kenyans who actually go through this and actually, you know, go ahead with the proposed treatment without finding out what it is that they actually need. I started noticing changes in my health, like major changes in campus, that is in Rwanda. I had gone there for nursing studies. Yeah, so around the final year, and we were now doing our clinical rotations and internships, I started noticing something strange, you know, losing consciousness. And you know, when it happens to you for the first time, I had never gone through this before, so you know, it's really alarming. But you try to self-diagnose as nurses, you know, we do that a lot, and you try to explain it, you know, this and this happens and this happens. And it was not a specific pattern. So it just happened today maybe, and then a long time without that happening. So I didn't connect that this could be related to an underlying condition. But then things got a bit out of hand after a while. So we started with, you know, minor losing balance or blacking out. And then I got a seizure one day. I was in ICU rotations in internships. So that's when I knew this is not normal, this is not okay. So in the beginning, I think it was one episode, and I just said this was due to this and this. I was working out a lot. I had not, you know, eaten very well. So I said, perhaps it's hypoglycemia, I just fainted. And so I spent like a long time without having another episode. And when they did, I didn't really count, but there were not that many, like that. It wasn't that frequent at the beginning. So, but later on, it started becoming more and more frequent. So sometimes I would just lose balance and not lose consciousness totally. So yeah, that was happening a lot. The losing balance was like a 2 seconds blackout. And then I just fall, and then I wake up, I'm like, nothing ever happened. So I never used to actually consult, you know, doctors for this sort of thing. I was like, it could happen, you're stressed out, you know. I never imagined myself to need, you know, you're the nurse, you're taking care of people. You don't expect that you're the one who is sick. So when I was experiencing this, and I think also being in the medical field clouded my judgment a little bit. You would go through that, and then I tried to convince myself it's this, and you know, I studied this last week. It seems pretty similar, and then all your colleagues are agreeing, like, yeah, it can't be nothing serious. And since I know I've been always healthy, sort of growing up, so I wasn't sickly or anything, so I didn't expect that something major is happening. I would just brush it off as, you know, it could be something just small, something small. And during all this time, So it could be that, or perhaps deep down I was afraid of finding out what's wrong, because it's actually my sister who insisted, and she found out by mistake, because I didn't want to inform, because I was in a different country and I didn't want to worry family at home that I'm fainting and this and that. Somehow she found out, I think from a friend, or I slipped out when we were talking, and she was really concerned. She's also a nurse, so she's the one that insisted, you need to get checkup. This is not normal. It's not okay. You can't explain. Okay, if you're fine, then that's good. Just go get checked out, and then we can confirm that you're in fact fine. And people around me, I think, were also agreeing with that. My friends who were initially supporting me that I'm not okay. So they were seeing that there could be something wrong. So I think they were just afraid a little bit of bringing it out like that. But I decided to take the advice. I decided to get checked out. So it was easier for me to get the checks, and there was nothing specifically wrong at that time. Nothing was found to be wrong. They didn't run, I think, a comprehensive checkup, because also I was not having so many symptoms. So they were looking for something else, and they didn't find. And so when finally it progressed from just the losing consciousness to having a seizure, so that's when I think it became very real, and that's a big deal. So I had to get, more urgent and deeper consultation. So I came back home to Kenya and started consulting a couple of doctors in their private practice, and just public hospitals, private hospitals. I was doing everything. I was going all over the place trying to get, to hear who is telling me something that makes sense. So we were looking up doctors who are renowned online, and we want to see, so where is this one based? Okay, we're going to see. So I remember going to this private hospital, one of the biggest around in Nairobi, and we did a consultation, ran a few tests, and I had to do imaging, brain and spinal cord, I think MRI. So I did that and came back for interpretation of results. So we came on the same day, and I basically walked into the doctor's office. He barely looked at my face. He was looking at a screen or something, swiping left and right on a tablet thing, and then took the report from the imaging. So he didn't interpret it himself. He just took the report as it was written, something cyst, you have a cyst, how many millimeters, I can't remember, and then told me, you have a cyst or a scar on your brain. So at this point I'm confused. So how did I get a scar on my brain? I don't remember having any major trauma. And he says that could be congenital. Some people, you were born with a scar. Okay, so what do we do about it? Because this scar apparently is causing me all these symptoms, and it's not nice. So how do you get rid of that scar? And he said, take this medication. I don't remember the name, but at that point I knew that kind of drug. It's a strong drug you take for a lifetime to control seizures. It's an epileptic, like a anti-epileptic drug. And he said, just take this medicine faithfully forever. And so we were asking, does this solve the issue? Will I stop experiencing the symptoms? And he just looked at us and goes, the symptoms might go or they might not. So just take the medication for life. And that's it. He wasn't having room for any further discussion. So very dismissive, very cold. He had put that barrier. So we walk out of the room with my sister, and we are not satisfied with the answer we've received. And she said, no, we're paying a lot for this. So we need to know, there's no need for him to give us half-baked information. We need to have some time and ask questions. How is this? How do we manage? So we were not very satisfied, and went back, and he wasn't trying to discuss with us at all. He was basically telling us, so what do you need? I've already told you, take this medicine forever. It's a simple, what's there not to understand? Yeah, and you were born with it. Take the medicine for life. You might heal or you might not. Medicine is like that. There's no assured. So he was talking all this gibberish, I could say. And so from there we knew we couldn't trust him, of course. And in other scenarios, actually, he might have been right, perhaps. He wasn't this time. But even if he would have been, we would not have trusted his opinion because of the way he delivered it to us. He was so dismissive. And I realized that most people are actually going through this kind of treatment. I had seen it before in hospital, but obviously not in my case. Different scenarios where not just doctors, but also nurses talking very harshly, and especially in Kenya, I would say, because I've frequented hospitals in Kenya mostly, and they're so dismissive. As healthcare professionals, I feel we should do better, and it's just something that's not addressed, because you go there and they just tell you, chukua hii dawa. There's no explanation. You know, I'm the doctor and you need to do as I say. I'm here, I have no time for you. And it's even worse when it comes to public hospitals, because I don't know what happens. Whatever happens there needs to stop. It's as though I'm doing you charity work, or I'm doing you a favor by being here. So you need to leave as soon as possible. Next in line, please come in. You know, I have a lot to do. I can't wait to leave this place. So it's more, most healthcare workers are not giving you their time just to listen to what you have to say. So it's easy to skip a lot of symptoms, a lot of important information or history while diagnosing, and also just the general adherence to medication or accepting certain treatments will be difficult for patients and their families, because they feel like this information has not been explained to them in a very easy way to understand or convincing manner. They don't understand, why should I go to surgery again? Did you say I need surgery? And they're just like, you need surgery so that you can get better, but you don't explain. A lot of these problems can be avoided, because this dismissal and whatever doesn't stop there. It leads to worse issues like misdiagnosis, and it just gets piling and piling, and the issues get out of hand. And patients really need to know their rights and what is to be expected from their practitioners or healthcare providers. Because once you know your rights, you'll be able to ask the right questions, you'll be able to demand the care that you deserve. And patients don't know. We have several rights, patients' rights put across by Kenyan government, because apparently our government cares for its patients, and put rights there for you to know. You have a right to information, and this information from your diagnosis to your potential treatment that are being proposed to you. You need to know the pros and the cons, and you need to decide. You have a right to refuse that treatment. You have a right to seek a second opinion. There's so many rights that you're entitled to. And going to hospital, you need to come equipped, knowing, because at this point now, if they want to infringe or treat you some certain way, you're at a position to ask, because it's within your rights. But once you don't know that it's within your rights, you're not able to ask for that better care. And most patients really don't know this. We have about 14 rights in the Kenya Patients' Rights Charter, and they are underlined there. They're the most important ones, I feel. The right to information, the right to informed consent. Don't just accept treatment that you're not fully aware of the benefits and risks involved, and all these issues that come into play. We just left. We didn't make any complaints or anything, and decided, okay, we're seeking another opinion. So I won't call it second at this point, because we had already been going around for a while. So we decided to go to private practice, because apparently the private hospitals were not delivering what they were promising to. And we sought a private clinic around Parklands, I think. Yeah. And so we consulted a neurosurgeon there. He has experience like 20 years to his name, and we were a bit confident with that. So we booked an appointment and went there. He was the first person that brought us closer to the truth, because he analyzed the images by himself. He didn't just rely on the imaging report, and he tried to explain to us. He diagnosed me, I think, with carcinoma, which is a mass of veins, clump of veins. He explained something, abnormal growth of veins. I don't remember clearly. He tried to explain to us and offered surgery as the necessary treatment for that. So that's the first time we were hearing surgery come to the table. So it came as a shock. And I was just looking around like, okay, did you just hear surgery? I don't know if it's just me, but most people are actually scared of surgery. And so we took that, went, discussed with the family members and said, okay, let's book a second appointment with the same person, because now my parents want to also hear what this guy has to say. Not just, they had a lot of questions also. So we booked a second appointment and we went there. He was offering a lot of options and tests. And he mentioned something, because we were buying the idea of that treatment. But he mentioned something about some machines or some equipment are not available in Kenya, which are needed in theater for that specific kind of surgery. So he mentioned that, and then when we tried to ask, so what do we do about that? Is it a necessary part of the treatment or whatever? He tried to dodge the question and start saying, okay, it's not that bad, we can do with what we have. And so we a bit shady at that point. And when people are sick or they have family member who is going through something, you're a bit emotional and a bit sensitive to these matters. So we said, no, we're not doing this with this guy. So we're looking for someone else, because if it wasn't as important as he's now claiming it is, he wouldn't have mentioned it earlier on. So what he was trying to tell us later, after we decided, no, we're not doing this, was like, let me go with you to India. We have this equipment there. Then I will be your surgeon there. All you just need to do is pay my ticket and stay and like all that stuff. So I think people are not buying the idea at this point. So like, if you're going to India, there are surgeons there also. There's no need to carry you all the way there. But we knew at this point we were not going to pursue treatment in Kenya anymore, because when you've been to the hospitals you think are the hospitals you think will solve your issues, and you find out that actually they're not doing it, and you've seen the top consultants, the top that we knew at that point that were top consultants, and they're not helping. We decided, okay, perhaps the guy had a point. India could be an option right about now. So let's find out where in India exactly and how to go about that, because I think India has a good reputation with treatment and all that. So with the dismissal, and it was becoming too much. This is 6 months now after I started the journey, and the illness is progressing and you're panicking, and no one is giving you an actual solution. So that was on the table for us. Let's see abroad. Let's look at India. Medical care is really expensive in Kenya, and we know that many people would not afford to consult physicians at the rate at which I was doing. I think my family prioritized that, but it was not very comfortable affording that, and most Kenyans will not afford that, especially in this private practice, private hospitals, when you have a condition that is beyond what regular, how would I call it, general practitioners can take care of. Because most people, I think Kenyans might have access to general doctors in majority of hospitals, but when you want to go to specialists, neurosurgeons, there are not so many also, there are few in Kenya. So it's very expensive, very harsh on the pockets, and it's our reality as Kenyans. I feel the healthcare has become even more expensive, even in public hospitals, which is shocking. So people might not even comfortably consult for any other conditions. Hospitalization, the bill is over the roof. There should be some sort of regulation, and it's something I feel, should be discussed with whoever is in charge of that, or policy makers. They need to regulate. Even with private hospitals, you don't just charge because it's our house now, we pay as we wish. Because I noticed with my test, it was different rates all over, and some would even double in price, and it's the same exact thing. And we wonder, so what's happening to us, like to the nation? Healthcare is becoming very unaffordable. People need access to doctors, people need access to specialists, even in public hospitals. And not just access, we need specialists who will be there for you. Also take into consideration, because if I had, for instance, if I found a good doctor on first consultation, and who would have coordinated my care with whoever is in the field or around them, and just taken keen interest in my case and taken his time, I would not have had to waste all that other money going around and around in circles. But it was the same thing. You spend a lot and then you don't get value for your money, and you have to look for another opinion elsewhere. And this is a major problem for most Kenyans. So with all these bills, hospital expenses that we've been incurring all along without getting any actual solution to my issue, I think at this point everyone was just tired. We need to get to the bottom of this. Let's just go elsewhere where, even if it will be a little bit more expensive, you can sacrifice that just so that you can get the care that you need and come back, because this going round and around is not helping, and it's even more expensive in the long run. So at this point, everyone is just tired. Everyone is desperate for a solution, because I'm also here and I'm unwell, clearly. And we all know that conditions become worse with time. If you don't take care of something earlier on, it progresses and becomes worse, and the symptoms become, more violent, more worse. So at this point, I think everyone was just agreeing on this one. We need to go elsewhere. We need to just sacrifice and, collect what we have, what we can afford, find a hospital abroad which is also affordable and that will deliver. And if we are convinced that they can actually get the job done, we are going that way. And it was actually shocking to me and to the rest of us that it was cheaper doing the surgery in India than what they had quoted for us over here. Of course, it was expensive, not saying it was cheap, but it was more affordable than the quotations that we were having in Kenya, like altogether, the packages that they were offering to us. ICU stay alone was just a different issue. It was very expensive. So we were expecting that maybe we might have to sacrifice a bit more just to get you over there. But we went there and discovered that was not the case. So it was like a blessing in disguise. So we decided that, and we look for, when I say we, just people who were supporting me at that time, found a bit of connections from doctors in Kenya to doctors in India, and found this hospital in India. I will mention it just because, yeah, they really helped me. BLK Max Super Specialist Hospital. Yeah. And they were a blessing to me so much. So we got connected there, and it was just like an instant, how can I word it? We just knew this was it, because of the way we hopped into a Zoom call with the team that was going to take on my case, and we talked, and they explained to us, and we discussed everything, and we just came to a good kind of conclusion, and there was a good connection there. So we were convinced that we want to try going there. Yeah, so, and I'm covered by insurance. So we said, because the limit for insurance cover that I had, it was a bit high. Yeah, so we said, if this can cover part of the treatment cost, I mean, when I think about it, could actually have covered the entire cost. The limit for that kind of condition, yeah. So it could have comfortably covered, so that we would have incurred maybe a few costs here and there. And we decided, okay, we want to request insurance to do this. And we wrote letters and all that. So they said, if you want to go abroad, just get a surgeon in Kenya to sign a letter for you that you're going, just so we can be sure that this is, I don't know, a lot of documents and what, you just need to do things formally. So yeah, we tried going to doctors and they refused to sign. I remember going to Kenyatta, yeah, and we met a neurosurgeon, and he said, so we had contacted him earlier, and he said, okay, we can do that if that's what you want to do and this is required. We can, I can look at the patient and conduct, a checkup and just confirm that indeed this is the case. So just bring all the tests and whatever and the imaging. So we went there, and to our shock and surprise, he lectured us for hours on why we think doctors in Kenya can't do a good job. Like, he was so mad and he refused to sign. Said, if you want, let's book an appointment. If you don't want a public hospital, I work with a variety of private top hospitals in Kenya. I'm writing this admission letter for you, so you take it there, they will admit you immediately. I will do the surgery myself because I've done a lot. And he was giving very radical ideas. It's something we laugh about nowadays, but I think I just remember something he said that stood out to me, because I had the imaging that had shown the cavenomena. At this point, we know there's something on the brain. We just don't know exactly what it is. It was like on the right frontal, so somewhere, yeah. And he just said, I will just cut you like on the forehead, like here, and open. And so when I think about it right now, it's comic relief. It's funny, but it's not when I think about it, because a whole surgeon, people who are in medicine would understand that that is not what you do in that case. You don't do that. But anyway, so we knew now insurance has failed us. Okay, maybe not just the insurance, just everyone was just against us, basically. Yeah, so, and at that point, people just said, okay, we can't keep doing this over and over. Let's just travel. So we travel, and I get to India. A friendly guy from the hospital comes to meet us at the airport, and we really loved that. He came with a cab. That was super convenient. They had booked a suite for us. They had done everything just because we're new, and it's easier for a local to do all that. So they did that. And they picked us up. We just settled in, went to hospital for the regular checks. And I had my first consultation with my to-be surgeon. He wasn't very talkative. I would have termed him antisocial. I know it's not good to diagnose people, but he wasn't very talkative. He was straight to the point. He was so busy in and out of theater. So the few minutes he gets with you, you just have to make the most out of it. No time for pleasantries like, hi, who are you? Okay, tell me what's the issue. And we explained everything that had happened. He looked at the imaging we brought from Kenya and other tests. And then just diagnosed, I have a brain tumor. And we tried to ask, what about the cavenoma? We had cavenoma, I had epilepsy. Like, I had so much to say that had been diagnosed with. It was like a long list. He said, no, you just have a brain tumor and it's growing, and we will just need to take it out. But before that, I need another imaging that we'll do just with our own facility to confirm, because there could be a switch up. I don't know, like, you can't just trust documents from another hospital. But he was really convinced that's it, and he explained, he just showed, on whatever and the medical terms, and simplified everything. And we were convinced this is actually true. And he explained what could cause, what happens, what is it like, what's the prognosis, will I heal, how will I? He explained everything and sent us for imaging. So at this point we're shocked. Okay, so do we start again? Second opinions? But no, because he was very clear. He was very articulate. We understood what was being said, and it made a lot of sense. So we just went and took the other tests that were required to confirm that, and was confirmed. It brought the team together, booked me for theater, and from there things were just running a bit more smoothly, because now we know what exactly is wrong with me that had not been caught for the past many months. I would have gone into surgery back home in Kenya for something totally different. So imagine what could have happened if someone, you know, opens you up to do something that is not the case. And just the thought of that makes me shudder. So the doctor organized or whatever, and all they do. At this point, I don't remember clearly all that was happening, because it was just very swift, because they knew we are foreigners, so it was swift. You know, they cut you in line, you booked earlier and all that. I went to theater. There was a few complications here and there. I stayed longer than they thought I would, so people were panicking and whatever. I got out. I was supposed to stay in ICU for 5 days, so I had been booked ICU for 5 days, but I regained consciousness, I think within the same day, moved out of the ICU. So yeah, I was having a really quick recovery, or they did a good job, or I don't know what was happening. So yeah, the healing process was moving a bit smoothly. I didn't have any complications, so the test, or I didn't lose any functions that I remember. Or maybe I did and I've forgotten. Whatever happened during that time, I mean, after surgery and recovery, it was just okay, I will call it smooth, not actual smooth, but there were no, you know, uncertainties as to what's expected. It was just clear instructions, clear information. If this happens, they answer with this. If I experience this, and they bring this solution. And I was discharged. I don't remember my stay in hospital. It wasn't that long, but I was discharged. Went to make a recovery back at the suit. Just till I'm ready to be checked and, you know, cleared that I'm safe to fly back home. So yeah, I stayed around for a while. I wasn't being a tourist. I was just in bed or in my room most of the day, and yeah, waiting. Yeah, they bandage or whatever. And when they took out the sutures, I was really scared. I thought, oh my God, what's to be expected? So the first reveal was just they opened, and I'm like, so where did you cut? Because I couldn't see, it was very clean. Yeah, I can say that, because I was just at this point, can I call it happy? Relieved. Yeah, that things are now going in the right direction. Because initially, you know, you're like, okay, you know, things to do with the brain. And when you hear tumor, you start to shudder, because you start thinking other conditions, start thinking cancer and all that. And yeah, they did run more tests on the mass that they removed, and it was benign, so it wasn't cancerous or anything, and it wasn't that bad. I'd say it wasn't that bad, but it could have been, because it was growing and the symptoms were bad. They could have been worse. Yeah, so it was just I call it a miracle to me. And I just kept thinking, and I think people in my family, people around me, everyone was just, you know, it's like a sigh of relief, because what if we did that? What if we let the doctors who were not really caring for her, you know, well-being, take care of her? Like, they were mentioning some, you know, sort of weird methods of treating and cutting me and all that, and mentioning it very casually, like it's nothing. And we were imagining things could have really gone south really fast. First, I would have gone under the knife without really having the real diagnosis. So, and we all know that would not end well, because it would need a follow-up surgery to correct the initial and the follow. And like, the human brain is a very interesting organ, I could say, because, and very delicate also, because you touch something wrong and, you know, something could go wrong. You could get, lifelong conditions or limitations from that, or just deformities and all that stuff. And apart from that, there's also this other side of doctors who are not even thinking surgery, who are not even a bit close to diagnosing my condition, telling me to take drugs for life. Drugs have side effects, drugs for a lifetime, they will just cause other issues in the long run. And since they were not even useful in my condition, that's even worse, because now the real issue is still underlying and it's progressing and causing all these other complications. So perhaps by the time I would be catching my diagnosis, or the tumor, or it's grown out of hand and surgery is no longer on the conversation, or it just has caused other major issues, there is a lot of limitations that could come. Sometimes when you get out of a serious problem, you don't want to think really what could have gone wrong. You want to think positively, and you say, God, I'm religious, so God worked this for good of me. Maybe made these people, not reliable just to make me get the best. Sometimes you want to think that way, but it's not always like that. When you actually think things that could have gone wrong, it's a lot. And even death could happen, conditions. People just die like it's a joke because someone failed to take their case seriously. Someone just dismissed them, saying, you're imagining things, you're doing all that. I was told many times, you're fainting because you have panic attacks. And some just said, women, most of the times women, they faint and they have during your cycle you can faint. And I'm like, no, it's not related to that. But, all these dismissals and trying to make you seem like you don't know what you're saying. At the end of the day, you're the one who is sick. If you see someone is ignoring some symptoms or trying to downplay some of them, I feel it's your right to raise that concern and really try to get someone who will take all that into consideration. Yes, women, I don't really think that's accurate, even like women faint. It's not something that is true to all women that they do faint. So yeah, that wasn't making a lot of sense. And it could have gone a different way. I'm just lucky and happy that it didn't. So I made a quick recovery, in my opinion. So yeah, and I actually defended my thesis or whatever was happening. I did it online before making a full recovery. My school was really flexible. I did a lot of things in that way. And I was well enough to attend my graduation, which is a major achievement. So after that, I think I just felt better and better. I never had to, go back for any complications. I'm fine now. I could say I'm totally fine now. But I'm sure with the brain and whatever they had and what, you can't really say you're totally healed after a year. I imagine it might take longer to be totally fine. So I wouldn't want someone to hit me, on my scar or, do something drastic there. Otherwise, I'm okay. And just to mention for people who might be experiencing the same thing, maybe you just start to faint out of nowhere or have, a seizure. I mean, don't take things lightly. I had taken things lightly in the beginning, and I was trying to downplay and say, it could be caused by something else. Yeah, I was lucky to have people push me, like, get this checked out. This is definitely not okay. So don't let people tell you you're fine when you're not. Your body, you're not fine. And just ask all the right questions. Don't settle for something because you're desperate. Sometimes it can happen, but if you're able to, always try to get better. After I went through this, and it was a very eye-opening moment for me. First I'm a nurse, so I'm also in the group of people that I think were not treating me very well during that period of time. But I was also a patient. during that time. It just made me realize how much people, you know, people lose their lives just because the right questions were not asked, just because a second opinion was not sought, or just because someone decided to be lazy that day at work. And it's really unfortunate to think that someone could, you know, okay, losing life is the most extreme point, but what about getting a disability because of this? Or the condition could worsen and be more expensive to treat in future, or the odds of healing are now less, you know, all this. And I was thinking, really, a lot of people go through this, and not all of them will have, maybe will think that it's okay to ask. Not all of them will know, or we have people to push them to seek for other, you know, opinions, or to support them through the journey. Not everyone has a strong support system like that who will ask the questions on your behalf. So, and it made me believe all Kenyans need to know their rights. It's something that seems so simple. It sounds simple when you ask people patients' rights. They won't really think much about it. And it sounds like it's easy, like patients' rights, okay, like I have my rights. But we are not exercising these rights in hospital, and medical professionals are also not respecting them. And the only way we can come to a balance is if patients know their rights. Yeah, because once you know what to expect, you know what you deserve, you are able to ask, you're at a better position to question people. At many times you feel intimidated because, okay, this is a doctor, they're probably more learned than I am. I should just take their advice and leave. I probably shouldn't question them. And I imagine, yes, I consulted many doctors, but I can't say that doctors in Kenya are not well learned. I can't really conclude that they don't know to diagnose. At the end of the day, I just feel it was negligence, or just a disregard for my life or something, because yes, they went through the systems. I think the Kenyan healthcare workers know what they're supposed to do, but unfortunately the ones that I came across did not want to do what they're supposed to do. So what I can advise people, it's not saying you need to go abroad for every little thing, or you need to do what, but make sure that you're getting what you should be getting out of the healthcare that you deserve to receive. Yeah, I mean, ask the right questions. Don't just accept things without, you know, demand for a certain doctor to see you. You can go and request, I want Dr. So-and-so, just because you feel more comfortable with them, or you think you like their style of treatment. But most hospitals will be like, nope, what you see is what you get. When in fact, the doctor that you're requesting for is licensed, he is authorized to perform the same procedure or to give you the same treatment, and it's within your rights. Like, you have a right to choose who to serve you in hospital. As long as, I mean, they are able and they are available, and also, yeah, it's ethical in that sense. But most people don't know that, so it's best for people to really know their rights. And this has become a major motivation for me. I recently started a YouTube channel, sort of talk show called The Deborah Show, where I shared my story, of course, and invite more people who have horror stories, I like to call them, from our healthcare system. And you'll be surprised how many people have gone through. It's almost as if a higher percentage of people have undergone some sort of mistreatment in hospital. It doesn't have to be, you know, misdiagnosis or negligence. Sometimes it's just the delivery of the treatment. Sometimes it's just a lot. And most Kenyans are undergoing this. It's like a pandemic of its own, and it's become a culture, like a culture in hospitals. And it's very much normalized. Ukienda hospitalini, like nurses feel we are so guilty of being harsh, yeah, to patients. It shouldn't be the case. I mean, I understand sometimes, but it shouldn't be the case. No one should be mistreated in hospital. It's your right. And when you know these rights, they empower you. They put you at a better position to negotiate and argue and find out what's right for you and what works best for you. And in this way, you can be able to avoid all these sort of avoidable issues with your health, because it's your health at the end of the day. You need to be a champion of your own health. No one will do this for you. And if you go to hospital and just wait for people to, stand up for you, unfortunately, that's not the case. So yeah, our healthcare system needs to reform, and it can only do that if the public takes a stand. Once you notice that your rights are not being, respected, and of course you try to question in the immediate healthcare provider, and you realize they're not really being very friendly or accepting of your complaints or concerns, you should take it higher. Obviously, within the hospital or institution that you are in, there is always a board that takes these complaints. And you can go to the front desk perhaps and ask, if I want to complain, where can I complain? Within the same institution, some have very serious, boards that will actually take action once you complain. And you can file official complaint, because different hospitals have different ways or formats for that. So you need to find out, for this specific institution, if I want to file a complaint, how do I do that? And then you can file your complaint, take you through the procedures and what have you. Perhaps they might be able to sort the issue there and then. Maybe you just needed something small changed within the same institution. They might be able to solve the issue for you. But sometimes the issue has gone out of hand. Maybe you've even lost a life because of that. Maybe you've become, you've lost a lot, or your health is now jeopardized just because of an error, and you want to take it higher, or you want, to sue or do whatever. But there's also the Kenya Medical Practitioners and Dentist Council. Yeah, you can file a report there, also official report for negligence, especially in hospitals. And there are just many boards that you can, you might want to go the legal way, you might want to go. So you need to find out what's required of you, especially within the institution, because I think public and private hospitals have different ways to handle such cases. But don't keep quiet. I feel if you escalate issues, you'll definitely make enough noise for people to take heed of what you're saying, and they might be able to handle the case. And for in my case, I did not report anything or anything. So probably whoever mishandled me is still there, and no warning, nothing. They probably do the same thing over and over to someone else. But it's our duty really as Kenyans. Just make sure you make that report, that complaint, if something wrong really is happening, because keeping quiet will be part of the problem. And we become comfortable now as medical professionals. Will become comfortable, and it's normalized, and it's okay. I can always do this and get away with it. And I feel in Kenya there's law. It's not like there's no law to regulate these sorts of behaviors. There's law, people are just not following it. So if there is law and there's rights for you, use them to your advantage and ensure that we can create the change that we are seeking to see in our hospitals. It all starts from policymakers and from the above. But the major issue now is we have rights, we have the law, but it's not being followed. So how do we go about this? And the public needs to come together and demand that we need change. We do not want this sort of treatment anymore. We also want to remember that as much as bad experiences are there, we also have the good in the healthcare system that has helped. There are people who would come out here and say success stories, and say stories of how the healthcare system in Kenya was a major blessing to their life, and how the experience was totally different and really good. And they met people who were so empathetic with them, people who cared so much for them. And so it's just something that we need to remember also. And we, as the Deborah Show, also appreciate all these wonderful healthcare workers. And we know that we need them, we need you, and we couldn't do without you. We need the healthcare system running, we need hospitals, we need people taken care of. We just want to highlight that in this majority of good people, we also have some of our colleagues who are not really trying to do their best. And that's what we want to change in our systems, just so that people know that the healthcare system in Kenya is reliable and it's trustworthy, because some experiences will make you have trust issues and what have you. But then at the end of the day, you remember that I know people who are not like that. I know people who actually care. And even within the same institution, one person could be like this and the other is the total opposite. So at the end of the day, it comes to play also personalities. Yeah, it's not just that, it's not about the title only. Someone could be generally a dismissive person. It doesn't matter where they are. Maybe today they are a doctor, they're like that. Perhaps tomorrow they're somewhere else. They might also make a bad, impression on people wherever they are. So it's just a lot comes into play with this, but we also would just want to recognize all our celebrated healthcare professionals and thank you for your good work. I have taken it upon myself to really be at the forefront, leading people, to know their rights, empower them, and just provide a platform for people who might have similar experiences with hospitals or with healthcare that they might want to share, just because these stories help people out there know that this is happening. Some people don't know that such things could be happening. So it's important to know that it could be happening and there's a way to stop this, really. And the major part that I focus on is your rights, patients' rights. I really focus on that a lot. And on the Deborah show, we discuss everything from your rights, your responsibilities also as a patient, because you also have responsibilities, and other medical and health matters that affect you, we discuss. So I would like to invite you all to join the movement. Let's inspire action towards positive change. Join the Deborah Show on YouTube and come, we can have meaningful conversations that would potentially change the healthcare system in Kenya.